In this video, we're going to look at the structural differences in the anatomy between the arteries and veins. And in this image, you can see both artery and vein, a diagram of each one of them. And you'll notice that they're made up of 3 layers of tissue. Okay, so 3 different layers help to form both these arteries and veins. And those 3 layers, the innermost layer is called the tunica interna. Some textbooks also call it the tunica intima. You could really call it either one, but this McGraw-Hill textbook calls it the tunica interna. That is the innermost layer of the blood vessels. It is made up of simple squamous epithelium, also known as the endothelium. So it's a very, very thin layer of tissue. It has a nice, smooth, slippery surface on the inside, so that those blood vessels, or so that the blood rather, can glide across those blood vessels, across the lumen of those blood vessels, without causing any friction or damage to the blood vessel itself. Now, outside of the endothelium, we have a thin basement membrane that is kind of superficial to that. And then surrounding that, we see a little bit of elastic tissue. Now, outside of that tunica interna, we then have what's called the tunica media. The tunica media is made of smooth muscle primarily, and you'll notice that it's much thicker in arteries than it is in veins. You'll also notice that in the arteries we have some elastic fibers mixed with those smooth muscle cells. Now, the reason that there are elastic fibers present in the arteries and that the muscle layer is much thicker in the arteries than it is in veins is because blood is being pumped out of the heart into the arteries. So arteries carry blood away from the heart, which means that the pressure in that blood is going to be much higher as it is traveling through the arteries than it will be as it is traveling through the veins. And so since that pressure is so much higher in the arteries, we need to have a little bit more elasticity in this muscular layer, and the muscular layer needs to be a little bit thicker and stronger to prevent tearing of the arteries as that high pressure blood is being ejected out of the heart. The veins are used to return blood towards the heart. So by the time the blood reaches the veins, it is in a much lower pressure, or at a much lower pressure than it was in the arteries. And so you don't really have to worry about tearing or ripping of the veins as you would of the arteries. And so that's why we have this much thicker tunica media in the arteries for some flexibility, some stretch and recoil and elasticity. We also have those elastic fibers mixed in to help with that as well. Now, the most external layer or superficial layer of the arteries and veins is the tunica externa. So think externa is external. This is going to be made of connective tissue primarily, and the tunica externa is going to be a little bit thicker in veins than it is in the arteries. This is also where you will typically see some nerve endings, some smaller blood vessels, things like that, to supply nerve supply to these arteries and veins to be able to send signals to them from the nervous system, especially in the arteries, so that we can stimulate this smooth muscle. The smooth muscle layer is also going to be used to allow for vasoconstriction and vasodilation. So if we want the blood vessels to be able to constrict, get smaller, or dilate to get larger, we can do that using that tunica media layer, more specifically the smooth muscle of that layer. Now, if you look over here in the microscopic image, you will also see an artery down here on the bottom, and you can see a vein up here on the top. So you'll notice that the vein is much more flexible. It's a little bit thinner and more pliant than the artery is, and that's again because that artery has a much thicker tunica media, a much thicker layer of smooth muscle, which causes it to be a little bit more rigid and a little bit stronger and tougher, so that when we cut through it, the wall of that artery does not bow or bend, whereas in the vein, since it's much thinner and the lumen of the vein is much larger, you will typically see some bending or bowing of that vein whenever you cut through it in a section in histology. So you guys take a look at this. If you have any questions about the histology of these blood vessels, just let me know.